Age-related macular degeneration. Macular degeneration, often called age-related macular degeneration, AMD, is an eye disorder associated with aging and results in damaging sharp and central vision. Central vision is needed for seeing objects clearly and for common daily tasks, such as reading and driving. AMD affects the macula, the central part, the retina, that allows the eye to see fine details. There are two forms of AMD, wet and dry. Bleeding, leaking, and scarring from these blood vessels cause damage and lead to rapid central vision loss. An early symptom of wet AMD is that straight lines appear wavy. Wet AMD is when abnormal blood vessel behind the retina start to grow under the macula, ultimately leading to blood and fluid leakage. Dry AMD is when the macula thins over time, as part of aging process, gradually blurring central vision. The dry form is more common, and accounts for 70 to 90% of cases of AMD, and it progresses more slowly than the wet form. Over time, as less of the macula functions, central vision is gradually lost in the affected eye. Dry AMD generally affects both eyes. One of the most common early signs of dry AMD is drusen. Drusen are tiny yellow or white deposits under the retina. They often are found in people aged 60 years and older. The presence of small drusen is normal and does not cause vision loss. However, the presence of large and more numerous drusen raises the risk of developing advanced dry AMD or wet AMD. It is estimated that 1.8 million Americans aged 40 years and older are affected by AMD, and an additional 7.3 million with large drusen are at substantial risk of developing AMD. The number of people with AMD is estimated to reach 2.95 million in 2020. AMD is the leading cause of permanent impairment of reading and fine or close-up vision among people aged 65 years and older.